Right, let's go.
All right, guys. Hi and welcome. We're live. Well, you guys aren't watching us live. Excuse me. Sorry. We are on our first episode for MCNN Patient Stories. My name is Amy Smoot, and joining us is one of our other members, Miss Bethany Hill. I'm going to be asking her a lot of questions about just her medical issues and why she uses like why she had moved out of state to be able to have access to cannabis, what it did for her, and basically how she feels with it versus without it, because I believe Bethany is off all pharmaceutical prescriptions. So we're just going to talk to her and see what she has to say. So welcome, Bethany. For those that don't know me, just FYI, my name is Amy. I'm an EMT. Did that for about 10 years of my life till I had a career-ending injury, and I've jumped headfirst into this cannabis activism, just like Bethany has. Just found out that a few moments ago. We have both just jumped in feet first, and we're doing this. And so, just a little history of me, if anybody wanted to know. Anyway, on to Bethany. All right, Bethany. So I've heard you talk a few times. You spoke at the rally in Jackson. Just kind of give us an idea about the medical problems that you deal with and your diagnoses.
I have quite a few. My major ones are fibromyalgia, psoriasis, psoriatic arthritis, endometriosis, polycystic ovarian syndrome. Those are my big ones that I deal with all the time and really hinder my daily life. There have been other issues that have come up in the past that I deal with, but those aren't as severe. Typically the fibromyalgia becomes my worst problem, but I mean, I have partial seizures. I have chronic migraine syndrome.
Wow.
Yeah, there's so many different things. I actually moved out west for cannabis. So when I was 23, they wanted to do a full hysterectomy. They wanted to put me on chemo for my psoriasis. Just one thing after another. They were talking about full disability. Lucky, if I would be able to, walk by my 30s.
Wow.
A lot of people with fibromyalgia, before, I did not know I had fibromyalgia at the time. So it was really just these 26 other conditions that they've been, doing one surgery after another. And they've been putting me on this medicine and that medicine. And then I just get sicker and sicker and everything would just start falling apart. So by 23, I was just really sick and pretty much on my deathbed. So I had to drop out of school, move home. And then it was just one thing after another. I was on 9 prescriptions when I had to go into the hospital for a week. When I got out, I stopped all 9 prescriptions.
Wow. At once?
All at once, which is, of course, very dangerous. But I figured if they were making me as sick as they were, and I was having to go into the hospital for a week, really, what was the other flip of that coin? It was kind of like I was at a point in my life, literally, it was cannabis or death, because I felt like disability check, just laid up in a bed for the next 20 years, just wasn't what I wanted.
Wow.
So I felt like there had to be something else. And so I decided to try cannabis. And within a year, my life was not only back, it was better. And within the next couple of years, it was really apparent that I was in need of this really bad. So we sold everything because, of course, I'm having to break the law to get medicine and get my life back.
It's incredible.
I can't really
Absolutely incredible.
tolerate like pharmaceuticals. They don't work with my body. They make me sick, and then I have all these different effects, and it's just not healthy.
Right.
So cannabis made it safe
So
to just live, and
you have,
makes sense.
yeah, absolutely. I mean, we come equipped with the system to handle it. So you say that, at 23, you were basically looking at full-time disability. What age was your first diagnosis? What was your first diagnosis? Because I know you said once you had one, it kind of spiraled. So what age did you start having problems?
I was always kind of a sickly kid. I always had like really severe allergic reactions. I just kind of seemed allergic to everything. I always had these really bad headaches.
Wow.
All these different things. I was just, my mom, often was like, what is your body's just so weird. Why are you having these reactions? I could use the same product every day for 6 months and then have a horrific allergic reaction to it. And then I would have all these headaches. And then it was like I was always sick. My body was always like fighting to stay alive. And then I got mono. And then,
Oh.
yeah.
How old were
and
you when you got
then,
mono? My kid
let's
was
see,
4 when they got it.
ninth grade, 10th grade. Yeah.
Oh.
I was really sick. But I always had like anxiety and panic attacks. And those started when I was 5.
Oh my, I can't even imagine. I have a 6-year-old right now in the other room. He has anxiety with thunderstorms, but I can't imagine trying to deal with anxiety with everyday life. With a 5-year-old. Bless your heart. So what age did you learn about cannabis, and was it someone's story that you heard and it helped them, or how did you learn about cannabis and what made you?
Um, my husband, actually, we had just started dating, and he said, a lot of people use cannabis to, kind of save their lives. He was like, from
Medicate.
cancer to anxiety to pain. And I was like, well, this is kind of it for me. I'm not doing what they said. I knew 40% of my body was covered in psoriasis when I moved to Portland. So 40% of your body open, hurting,
I can't
the
imagine.
psoriatic arthritis, my joints.
I can't imagine. We've talked a little bit about it before, and you've seen the skin issues that I have, and they are so small and so minuscule and just really just affect one small area of my body at a time. I can't. How did you sleep? How did you eat? How did you work?
There have been times with 3 months that I had to sleep with an ice pack on my legs to keep from scratching at night. I've had shots in the back of my head, steroid creams that left scars, you name it. But when I found the safest relief was just simply applying CBD oil or salve directly to my psoriasis. I have a little bit on my arms now, and that's it. And I use CBD salve on my joints as well to help with that.
And that gives you
Farm Bill
relief.
2018.
The CBD, the salves, those really, without THC, those help your muscles in your joints and your skin and everything else. So just the hemp plant, not any other part that can get you high or anything else, that helps your skin, it helps your joints and those kind of things. That's incredible.
Oh, absolutely. I use it for my headaches, bug bites, you name it. And I mean, it really, when Farm Bill 2018 happened, it changed the lives of so many people. So many people in Mississippi already are getting so much relief from these products. And without that, I don't think I'd have been able to come home at all. And I did have to go back on one pharmaceutical when I moved home. And because I just don't get enough out of CBD products, unfortunately, it's just not enough.
Yeah.
And that's just is what it is. And this state, we pushed for ballot initiative 65 for that reason. We don't want to be criminals. We want safe medicine.
Exactly.
It's that simple.
It really is that simple.
Yeah, I left for 7 years so I wouldn't be. Now, I moved home when my mother-in-law went on hospice. We helped take care of her the last 3 months of her life and decided to stay. I mean, are we that selfish that we want to raise our daughter with our families?
No.
Is it that ludicrous that we're not willing to just give up everything again for just a simple medicine that doesn't hurt anybody?
No, and especially when it's legal in 30 something other states.
Yes,
I mean, it just doesn't make sense. There are so many benefits, not just the health benefits, but the economic benefits to legalization. And we're going to stay on the medical because I feel like that's where really what the focus is right now. But tell me about how you felt when you moved out west and you used cannabis for the first time. What kind of relief what did you think? Were you just like, oh my gosh, I can't believe this worked? Like, I feel good. Did you wake up and were like, I feel okay? Like,
oh, I had started using it before I moved. I used it for a few years illegally. But I mean, before I was willing to give up everything I had.
Oh, absolutely. Absolutely.
But when I moved out west, I had high grade medical cannabis, and that's when my life changed. At 15, they told me I would never have children. I had endometriosis, polycystic ovarian syndrome, and I have a lot of issues with both of those. And a year after moving out west, I was pregnant.
That is amazing. That is amazing. Think
She's
of how
7.
many
She got to
people.
have her 5th birthday in this state.
That is so cool. That I just can't believe it. So, do you still see providers here locally? Do you still go to the doctor on a regular basis? Do you have specialists that you have to follow up with? If you do, what are their opinions on cannabis? No, you don't?
No, actually, up until I started using cannabis and quit the non-prescriptions and kind of just said, I'm not going back. I'm done being a lab rat, essentially. I mean, they were basically saying it's done. I wasn't done. I knew there had to be something else somewhere else.
Right.
And so yeah, I kind of just stopped, but pretty much, I mean, over half of my life was spent, just being poked and prodded in different medicines and being told like devastating, you're not going to have kids, you need a full hysterectomy. I didn't. No, I
Thank
didn't.
thank goodness you did. I mean, goodness gracious, what if you wow. It's so incredible to me that we have physicians that are okay with this line of healthcare, if you will. Sorry, my air quotes don't work well with the background, but when there is such a much safer alternative out there for people, and if you don't want adults to have it, like that's cool. I get that. There's kids that can benefit. Like there are people of all ages that can benefit from this. It can help everybody. And it's just, it blows me away. Is your arthritis, do you have as much inflammation problems since you
I
started?
mean, I have a lot harder time here. Obviously, it's not as easy. I do have to be on one prescription, so I can't say that, oh, when I moved back, it was, that CBD gets me through. But I mean, I have to use a lot of different CBD products, oils, tinctures, like that under the tongue. And then I still use different inhalants and edibles and stuff like that, salves and all these things that you can get at all these different CBD stores and stuff around. A lot of good organic natural products out there. And it makes it a lot easier. Don't get me wrong. But it's not as easy or I'm not as healthy as I was.
Right.
And it's a huge difference. And I've felt the huge difference since I moved back. And it's just that thing that keeps the fire going. It's like I've seen the other side. I've been on the other side. And I was living in Washington, working in Oregon, and both states went recreational when I was there. And guess what? Everything pretty much stayed the same. You had some new stores open. And I just hate that it's so demonized, and it's just not like that. It doesn't happen like that when it just
doesn't.
changes.
It
Just
does
like
not.
Farm Bill 2018 just changed things. People didn't think that the whole world was falling up because there was a CBD store that opened up down the street. They're like, yay, now
Exactly.
I can get a salve for my arthritis.
I
And
know
it's
the farm bill personally, my dad has gotten great benefit from CBD. He's one of those people that's had 2 knee replacements, and everybody
oh,
says, oh, once you have knee replacements, you'll never have a problem out of your knees. They've never been right. Never been right. Narcotics have never touched his pain. Even IV narcotics when he was in the hospital post-op did not touch his pain. And so you get to that point, you're just like, what can I do? And we had a CBD shop right up the street. And I actually walked in and started talking to the guy. And I said, look, it's my dad. He's kind of medically complex, but do you have anything that would kind of help? And he set us up with a CBD tincture, and my dad got such great relief from it. He was sleeping. And it really can just do wonderful things. But I kind of also want to talk about what CBD isn't capable of. So talk to me about the medical problems that you have. I know your headaches are probably one, nausea is probably one that you deal with that aren't relieved with CBD. So talk to me a little bit about the difference about what's helped with CBD and what is not helped with CBD, and you need a THC product to help with.
High THC products are really good for inflammation. Now, all the different cannabinoids, we're discovering more and more every day. So we'll discover things.
Oh, there she
Sorry,
goes.
I lost you for a second.
That's okay.
Sorry. um, so each cannabinoid is a little bit different and is a little special in each way. I always benefited from, the entourage effect. So items that have THC in them. I just noticed that I felt my best when I did. Now there's a lot of research and stuff coming out now about all the different reactions and stuff that you get from THC. And we find that it's great with inflammation.
Right.
So with a condition like fibromyalgia and psoriasis, where you're
Oh,
constantly,
yeah.
your system is in constant inflammation, it really
Yes,
has a lot of reaction. So I have to take this medication now that kind of helps, because of course you can't have more than 0.3% THC right now. Um,
exactly.
so I have to take this medication, which causes me to not only have more frequent migraines, it also causes me to have nausea a lot
Oh,
and
wow.
severe dizzy spells. I mean, and I can't take painkillers. It's not an option for me. And I have a pain disease. Like, it's not
That's
an option.
that's terrible. I mean, to think about someone with fibromyalgia not being able to adequately medicate, it's scary. I'm a pain patient as well and have been for 9.5 years. And it's hell. I mean, there's just no other way to put it. So I can't imagine not finding some relief and how exhausting that has to be. And then you still have to go on and mom, you still have a household to take care of, you still have dinner to cook, you still have all these things to do. And you can't. I mean, you just feel so shitty, crappy, excuse me, that you just can't. So I was just interested to see, when you moved out west and you were able to access a higher quality THC product, because what a lot of people don't understand is, yes, you can find THC on the black market here, but it's not something that's grown in this state. It's not something that you know where it came from, and you don't know whose hands it's passed through before it got to you. Whereas when you're in a dispensary setting, you have all of these things you have to follow, things have to be tested. It's a whole different ball game than I think a lot of people realize. They just see, oh, medical cannabis, and they think it's just, no, there's certain strains that help with certain things. There's certain things that are great for nausea. There's certain things that are great for ADHD. And so I really think that the time, like you said, right now, watching all of this information and education come to the surface, and we've only begun to scratch the surface, because as we all know, we can't have any kind of federal research done on it while it's still a Schedule I drug. Even with the facility here in our own state that has been the only facility until recently allowed to grow cannabis, technically nowhere else is allowed to do any kind of studies on it. So we don't know how this helps. So I think talking to real world patients like you that have been out west and have lived in a state where you had access to a high quality, high THC product makes all the difference. It's not just something you can go find on the street. You can't call somebody up and get what you would get from the dispensary. All that has to be tested for pesticides as well, fungus, mold. Everything that you buy on the street, nothing has to be tested. So we had the incident recently where someone was stopped in the state of Mississippi and they confiscated a great number of edibles from California as they were marked, and the mayor of the town was standing up there talking about how this medical cannabis, it's a counterfeit product.
Yeah.
Just about every state that has dispensaries has laws that dictate that we can't have packaging that says candy, lollipop. It can't appeal to kids. It can't be bright colored. But there's still so much education to be done when we have mayors of towns that he really believed that was medical cannabis that he was holding, like genuinely went to bed that night and thought, I've done a good job. This is real good. It's not true. That is not this type of stuff you get from a dispensary. And so I just think hearing that aspect is really important. And you talked a little bit about side effects. Tell me more, please, about the side effects of all the pharmaceutical drugs that you're on, or that you were on, and their
Yeah.
side effects, what it did to you.
Oh yeah. The migraines, blinding migraines. When I was at Ole Miss, I had a migraine for 2 months straight. I was,
Oh my.
yeah, when I was at Ole Miss, I got really, really sick. I mean, like I was losing consciousness. They couldn't figure out what was going on. My glucose was up and down. I literally had to wear a needle in my stomach with a monitor around my neck for 3 days. And then I had to do it again for another 3 days. And they still couldn't
Oh
figure out
wow.
what's causing it to shoot up and down because I've never been right. Like what people normally do, my body never does that. So I have issues. Usually, someone who has fibromyalgia, your entire system is off. So you have issues with your respiratory system. So, like, I have some allergy asthma that I have to worry about, which, where it comes to like healthy, safe products, really comes in for me.
Absolutely.
Because you kind of have to deal with that if you don't know if you can find a safe place to get it. And as long as we don't have a medical program here, you do run a risk if you do buy black market.
Yes.
Mold and things like that. Well, if you are prone to asthma and different things like that, if you do use an inhalant and you have an allergic reaction to some of these things in there, or maybe a chemical reaction, allergic reaction to some of these pesticides, anything could happen. If you can have the option to have a safe market, then why not?
Yes.
Uh,
Yes.
why not provide cancer patients who can't risk taking in mold into their lungs? Why? It doesn't make sense to not have it,
It does
especially when
not.
I've seen it just in real world. It's just normal as a gas station, probably a safer place to walk into than a gas station.
Yes, absolutely. I've never been in a dispensary, honestly. That's kind of incredible to me. My dad actually beat me going to a dispensary. It's 2021, y'all. It's wild, but I have never been, and it is definitely one of those things that's on my list, just because I've never had that experience where you can walk in and have an open conversation with the person behind the counter and say, this is what my problems are. What strains work best for this? And people think the people working in dispensaries are just potheads, quote unquote. They don't
No.
know anything. These are some of the most intelligent people. They study this. A lot of them spend, like you and I do, their free time reading, researching, looking up, trying to educate themselves. And I just think, I run into people all the time that are like, well, I can talk to a pharmacist about this, and I can. No, you can talk to the people at the dispensary. That's what they do. They can help you. They have talked to people before that have your same issues, and they can say, hey, this is what you're struggling with. Try this. And then if you take that home and it doesn't work, and you come back and you say, hey, this made me feel like this, and it didn't do this that I like, and they can point you in another direction. It's just like pharmaceuticals. Like your doctor goes and they say, oh, that doesn't work. Okay, we'll try something else. Okay, we'll try something else. It's just like that. It's just, there's
Yeah.
hundreds of thousands of strains. There's tinctures, edibles, smokables, you name it, salves. chapstick. I've
Yeah.
seen THC packets for water. It's just, it blows my mind, all the
Oh
delivery
yeah.
methods. And
Oh
every
yeah.
one of them is important. Like you highlighted, you get different benefits from salves, lotions, creams, and, edibles and things that you inhale. So you get different benefits from every different way that you consume.
Well, each way metabolizes different in the system, so it's going to affect you at a different rate.
Exactly.
I use lots of inhalants because I have fibro, which means pain comes on fast in lots of different forms. I deal a lot with neuropathy. I deal a lot with bee sting sensations all over my body, burning sensations, stabbing sensations from head to toe at random. So I need something that I can use really fast. But anytime, I'm a firm believer in cannabinoids. So when I was out west, I mean, I could buy hemp seed to add to my granola from Costco. So,
At
I mean, I popped
Costco.
it in however I could. Yeah, there was a huge bag of hemp seeds, and they're so healthy for you. Um, I mean, I can just go on and on. There's so many great things that I've experienced. And then when I moved back here, I mean, it was a swift decision, but um, I just, when it was all said and done, we didn't want to leave and we shouldn't have to. And then that's when I decided, like, I don't want to be ashamed of who I am anymore. And I'm not ashamed that I use this plant. And it saved my life. And I'm going to be very vocal about that. And that happened about a month after I got home. And I experienced, like, we didn't even know what it was. Eventually, the doctors just stopped calling me back. Basically, they thought I got bit and or a plant a reaction. And then all of a sudden, like, my entire side is black. I mean, I just had bruises all over my side for about, I don't know, probably about 2 feet down. And they couldn't figure out why. I had x-rays, you name it.
Y'all, she's
So
not lying. She sent these pictures
I've
this
got
week, you
pictures.
guys. It is horrible. When I say it's worse than you think, it's worse than you could think ever.
I mean, yeah, some of the bruises were the size like of my hands, and they're just like black bruises. And of course, like, the doctors just blow me off. And then that's why my mother still gets on to me about, like, not seeing the doctors. I'm like, but why? I use cannabis products and I'm happy and I'm healthy and I feel great. I've still worked full time up until I give up everything to do this political activism full time for
Chase the
free a couple
stream.
months ago.
Chase the stream.
Up until then, I still worked full time. I mean, but like, to have my daughter, like, yeah, I was pregnant a year after I moved out west, and it sounds like, oh, great, she had a great pregnancy. Now I had to see high risk doctors, my neurologist, my doctor. My doctor met with all of them. I know they met at least every time that I met with a high risk doctor. My doctor met with them afterward the following week.
Wow.
And I was in labor for 62 hours.
Holy,
I didn't even have a Tylenol.
Smokes.
Again, pharmaceuticals never do me right, so I'm avoiding them, right, as much as I can. I'm just trying not to do it.
62 hours.
Now, I wasn't just in labor there. That is them trying to induce me. I did 4 rounds of Pitocin and a Foley bulb procedure.
Oh my gosh.
And they couldn't get me to go into a full active labor where I could actually have her. So
wow.
They have to decide they're doing a C-section. So then it comes time for the medications, and then I'm sick, and then I'm losing consciousness, and then I'm bleeding out during the C-section. Now, during my C-section, I had 3 doctors, 6 nurses, and 2 anesthesiologists. And so, it's crazy. And my uterus did start spraying blood, and I was losing consciousness. And then for the first 24 hours, I could not lift my head without vomiting everywhere. Couldn't even lift my head. If I did, I puked everywhere. I was scratching, open wounds. Just severe allergic reactions to it. I could never have morphine again after that experience. I had to spend a few more days in the hospital after that. That's not my first time.
I can't imagine being a brand new mom and experiencing all that. You can't even take the time to come into motherhood and you're just trying to survive, literally trying to live through it. Oh my gosh, honey.
Oh yeah. And then I did not heal for 6 months. My C-section even almost abscessed at one point. I went on multiple rounds of antibiotics. It was a full 6 months before they ended up having to do plastic surgery and skin grafts. So I had a full open wound for 6 months after having my daughter that
So
would not heal.
you basically were pregnant for 2 years and dealing with the effects of pregnancy and for 2 whole years. Okay, so I'm going to ask you something that's a little taboo, and please, if it's not something you want to answer, please just say I decline to answer that. You were pregnant when you lived out west. Did you use cannabis when you were pregnant?
Oh, yeah. I stopped using it at first, and then I got a 10-day migraine that I couldn't shake. Now, they gave me pharmaceuticals, you name it. We tried to figure it out. It wouldn't work. And my doctor started asking me, like, what happened? What changed? And I was like, well, I stopped using cannabis. And it was like, why? And I was like, because I'm pregnant. And then it was like, you better be done smoking cigarettes the next time I see you. That's what you got to stop. And basically, the only danger that my child was in for me using cannabis products was there is some danger anytime that you use any kind of inhalant that your child might be short. And he even made a joke about that. He's like, but he looked at my husband, looked at me, he was like, but we already know your kid's going to be short. It's just a different environment.
Yes.
They are so much more able to be themselves. And they looked at my medical history. You know what I'm saying? They could see the evidence there. I wasn't having to take a seizure medication anymore, a migraine medication. They gave me a shot of Imitrex at Sims Murphy, and I coded.
Oh my gosh. That stuff is horrible. That stuff is horrible. I hate Imitrex. It's one of the worst medications. And that's just, I'm sorry. So do you have any like cardiac issues or heart issues or?
So, but like when I've noticed at different times, like when I was really sick at Ole Miss, they were noticing like it was fluttering. It was not catching beat right. It's not something that happens all the time, but when my body was in such distress, I was having issues with my heart and stuff. Now, I used to get for a long time because every time I went to the doctor, it was some horrifying news. So every time I would go, like I started having like really high blood pressure and like anxiety when I would go. And then cannabis made me feel like I don't really have to go.
I don't need them
bad
anymore.
Happens, I'll go. Other than that, I'm just going to keep doing what I'm doing because I feel better than I ever have. And then if you look at the medical history of everything I've been through, every procedure from tumors taken out of my body, from having surgeries on my reproductive system, you name it.
How many surgeries have you had in your life?
I've actually refused a lot of surgeries, actually.
Really?
That's the kicker.
So they
always want to cut on you.
More things to you than what you had already endured. Wow. The audacity of these people sometimes blows me away.
No, like I'm a walking anomaly. They want to cut on me. Like, let us study.
You must have diamonds inside. That's what it really is.
But I just kind of figure that life is precious, and we're all so fragile. I can spend my whole life talking about mine, or I can take mine and say, hey, look at what happened. I don't know if it's going to happen for you, but it's a safe thing to try. And that's how I've done CBD therapy with people for the last 30 years. Is all I know is when I try pharmaceuticals, my life has been in danger multiple times.
Yes. Multiple times. You're talking about coding and being in labor for 62 hours, spurting blood. These are not things that are normally considered to be okay things.
Oh, no. When I went in with a cyst rupture that had got infected and I could barely walk, they gave me 3 shots of, I believe, Dilaudid or Demerol, whichever one is like lower than the other D one. And then I don't know a lot about these things because I can't take them. And then I found out that they came in with a 4th shot, gave it to me. And then I asked what it was, and she said morphine. And I started screaming at her, like, what have you done? I can't tolerate painkillers. How much have y'all given me? And that's all I remember is yelling at her about giving me that shot. And I wake up in the hospital the next day. With claw marks, open wounds from my face to my legs to my arms. I didn't remember anything. I had like cussed everybody. The nurse, yeah, like I was way over medicated, like severely. So I go in with this horrific. Well, of course, I didn't know what was going on with my sis then, but
Gosh.
then I have all these open wounds and these. I mean, just a horrific amount of pain. I have fibro, like. I mean, it was just so much worse than it could have been. They could have eased me into it, offered me like, I don't know, heating pads or different things we could have tried. Now, when I was out west, it was a more patient involved. I was asked a lot about what things that I wanted to try. Do you want to try this new medication that just came out? No, I don't feel comfortable with that. I don't think it's a good risk. I'd like to stay what I'm doing or whatever. And then it was like, okay, well, you're using too many inhalants. Maybe try to use some of the edibles and tinctures and try to expand to using some of the drinks, different things like that. And that just helps save. You can also buy more expensive devices like vaporizers and stuff where you can put dry herb in there and
Right.
it doesn't actually combust, so it saves you the carcinogens there. But there's so many different options when you're in a legal state. You
Yes.
can just get safe things to try, and I
And
just love walking in there.
all routes are important. It's important to have access to all of them because, like you said, what works for some, just like a medication, just like a pharmacy prescribed medication, some things don't work for every person. So you may have to try a different delivery method, a different route, a different way of getting it. And so I think our legislators have kind of at first focused on the no flower, no flower. We've seen so many programs, especially close to us, that don't have flower. And
I think that's a
thankfully,
mistake.
and I think they realized that real quick.
Well, I
Because
can't vape. I have a lot of the things and chemicals that they make these with cause me to have allergic reactions, asthmatic allergic reactions. So I need flour, safe, the purest organic, safest flour with the least amount of chemical influence. And
yes,
that's what I need. And I've been in a legal state and had my options to pick everything and tried it all.
yes,
So believe me when I say, like, I know specifically what I need and what the safest route is for me. And that's what I fight for. And that's what I've been fighting for because I've already tried all the different things. Now there's new things that coming out we ain't even got to play with yet because I've been here for 3 years.
and we can't wait.
I
But
know.
so we spent a lot of time on pharmaceutical side effects, and I haven't asked you this question yet because I know the answer is short. But for the sake of people that don't know, take some time, all the time you need. Tell me about the side effects you've had from cannabis.
Myself personally, I don't get a lot of the same effects that a lot of people do. I'm typically not I'm not plowed and put into the sofa. I usually get so much of a pain relief off of it. It gives me an opportunity to work.
To
It gives me an
function.
opportunity to function, do the dishes, these little things that I can't do. Even getting a shower, it makes all these things and it works so fast so that I can start my day. I can go get these things done. Um, but there are some people that have like paranoia and stuff. Now I haven't experienced different things like that, but some people haven't real bad. But it seems to have a very medicinal effect with my body, and just it pushes my body to just start getting and moving. you
Yeah.
know
See,
it just, the
because
pain starts driving away, and it just starts, the day starts off great.
it's incredible. I can say personally, like I said earlier, I'm a pain patient, have been for 9.5 years now. And I take opiates 4 times a day currently. It's horrible. I hate it. And my liver is pissed off, and my liver levels are now through the roof. And we're trying to figure out how to undo 9.5 years of opioid use. Um, but I can say thoroughly that I have never had all of my pain relieved with opioids ever. It's always just enough to be able to get up to go to the bathroom or get up to go cook dinner or fold a load of laundry. It's just, they don't allow me that. They help, don't get me wrong, they do help me, but they don't give me the energy to get up and do anything. When I take them, I'm basically useless. But that pain control, being pain free, I think that's something that our legislators don't understand, how much that can change a person's life, going from being sedentary to having an active lifestyle, all because of cannabis. Like, they don't realize this is going to happen. This is going to be so good for so many people in this state. We're one of the most unhealthy states in the union. We're at the bottom of the bottom, and our people need help. We have used pharmaceuticals in this state enough. Good heavens, enough. We should all be healthy, and we're not. So I cannot wait to see some of the people, the relief that people get when this becomes a real, and it's going to happen. It's not a matter of if anymore. It is absolutely going to happen. And we're going to get what we asked for. And to be able to take part in this piece of education and just getting the word out there, having conversations. All of us know that pharmaceuticals aren't the best for your body. Everybody, when you come home from the pharmacy and you get your printout and it's 3 pages long of side effects for the one problem that the medication was prescribed for, may cause anal bleeding. Well, hell, I just have allergies. Like, I don't need that.
It's like with cannabis, the dangerous Cheeto consumption. Like, Cheeto consumption's not a danger.
And a nap, and a little nap. You might get a little
and
nap.
some of the best sleep in your life.
Yes. So another thing that I don't think's really been talked about that I'm going to ask you, and then I'll kind of get to winding down here before long, but since it's not been legal in our state, are you able to drive on it? How do you feel? Can you function like a normal everyday person? Do you feel like you have deficits when you're under the effects of THC, or any of those?
Nope. No, actually, the more I consumed cannabis, the more I was able to stand up from the sofa by myself.
Louder,
the more
honey.
I was able to walk across the room. The healthier I became, the more I consumed. Now, I have found that about 1/8 a day of inhalant is usually a flower is my sweet spot. My body, my ECS functions at its best with that amount of cannabinoids getting put in my body, yada, yada, yada. That's what I have found. And I have lived for like, we're talking 15 years, y'all. It's not like this was yesterday. And I gave up everything and packed my car with my husband with what would fit and left. You don't do that if you have not found some serious evidence that you need to give up everything and go. And I was still ashamed of it. I still kept it secret from my work family. I was afraid that they would think I wasn't as hard of a worker. Now, when I moved home and I got sick, so bad sick within a month of moving home and not having it, and I'm having like what seems to only be the answer was internal bleeding. I started using CBD products as much as I could afford.
Which is not cheap.
It's not cheap, which is i.e. I went back on the one prescription. It's a necessary evil, and now I have side effects from that. Yes. I have severe nausea, these severe dizzy spells, but luckily cannabis products actually help that. Now you'll be like, well, what if it's the cannabis? It's not, because I went without the cannabis for quite some time and I had to go back on this medicine, and I was on this medicine, and that's why I stopped taking this medicine a long time ago.
To begin with,
any of that. I didn't have any of that when I did without it. And when I got back on it, guess what? Bam, here all it goes again. So yeah, the evidence is there. Now you're talking about being on it for a couple of years, getting off of it, and then getting back on it. So yeah. And then no, the cannabis products did not have that effect. But people also want to try like a tincture and just think, okay, I should start feeling better. No. I lived out west for 7 years and tried everything from inhalants to salves to balms to shampoos when I had scalp psoriasis, you name it. But I mean, I was still exploring. You have to microdose and try lots of different things, just like how they don't. Medical is a practice. They give you these prescriptions to try because
Yes.
it looks like all these things maybe match up with all your things. And maybe if they give it to you, to feel better. Now, if you come in and you have this, they've also been recommended to give you this prescription. Oh, but if you get, like you said, anal leakage, oh, well, we'll put you on this other medication. Then all of a sudden you're on 6 medications that are making you so sick you can't even function or drive down the road. They kept trying to increase medicines. I was like, I can't drive on that medication. You have to understand, like, I got to go to work and I can't drive on it. Guess what? I've never had any of these side effects with cannabis.
Wow.
Ever.
Isn't that amazing? Isn't that amazing?
It is.
You've never run over
this huge world of the history.
You've never run over anyone. You haven't melted into your couch like those commercials from the early 2000s. I think I'm really showing my age there, but you've just been able to live a normal, productive, everyday life. That's all cannabis did, is it made it able to have a normal life. Somewhat.
Well, I mean, not just that. I mean, most people will tell you I'm the busiest person on the planet. I never stop.
You don't?
I never say no. If I can help anybody with anything, if it's a reporter who's needing to do some kind of piece on this, can you help me do that? Yeah, absolutely. Let me get in touch with somebody. Like, I just don't know how to say no, especially when it comes to good things like cannabis, veterans in Mississippi, human trafficking victims and awareness. I mean, you name it, I've been involved in it. So no, activism is probably 6 full-time jobs that don't pay.
Yes, it is very much so. And it comes with quite a bit of,
I do them with a song in my heart.
You really do. You give so much of yourself. I don't think people realize what you struggle with, because you are so productive. Like you outwork healthy people all day long. And that's just a fact. And I think that's the story that people need to hear, is that this isn't going to turn people. These are people that need relief. These are people that want to be productive members of society. We have veterans. We have all these people that want to be a part of the world and want to function normally and not have nightmares and have anxiety and not throw up. And we're just going to be a better people. Like, that's it as a whole. That's all that's going to happen. They've done a real good job at trying to present medical doctors, pained me to say that, at their congressional hearings. However, I don't think these doctors have truly been in patient care very often. If they are, they're kind of scary, because they're so closed-minded that it's terrifying, quite frankly, to think of a provider handling your medical decisions that is so closed-minded that they can't even think about cannabis. And I quite frankly think they're full of crap, because I have 6 medical providers that I see on a regular basis. I'm talking every 8 to 10 weeks. Every one of them encourages cannabis use. I have one that prescribes the FDA approved version of cannabis, their Marinol savior that they like to hang their cross on. It's garbage. It's trash. It is not worth it. Insurance companies don't pay for it.
I've tried it as well. No.
It's
been
horrible.
there, done that. Nope. It's an absolute waste of time. It is a waste of manufacturing.
Yes.
Give us the natural organic plant. We need nothing more.
That's it. And I think we're finally getting there. Finally getting to the point that we're getting them to see this. So that makes me so happy.
Yes, for sure.
It's
And
exciting.
we're really pushing in Mississippi. It's been a really beautiful thing, all these people to come together. There's so many different groups fighting side by side and coming to the government together from all these different angles. It's been incredible to behold.
And it's so many people from so many different walks of life. Like we talked about it earlier, children to people my dad's age and older. My dad is 70 almost. So you have people from every walk of life. And granted, my dad is old enough that he was alive and used cannabis back in his day and grew up and just kind of followed this thought line of it's illegal. I have a family. This is just what you do. And then he met Riley, the little girl that's so close to our heart. And he heard her story and he's like, wait, if it can do this, take a child that was seizing all day to no seizures, what are we doing? Why are we pumping them through full of controlled substances, which they are fine with writing your child or your grandmother, either one, 6 different controlled substances. But a plant we can't have.
Yeah.
No, we're changing.
That's what I'm saying. No, and it's ridiculous. And in the age of the internet, what they didn't expect is in the age of the internet, we're no longer ignorant. We can communicate with people in Israel doing research, even though you've limited us in the United States. We can communicate with people in all these different areas. And in Jamaica, we can look at their studies and see what their culture and what they have figured out, accepting this plant and having it as a normal part of their life. We can discover about the ECS and how it developed 250 million years ago in a sea squirt. All of these things are coming to light and they cannot keep them hidden anymore. There's no reason they would have a patent on something that has no medicinal value. Correct. There's no reason that they would be growing it for 50 years if it has no medicinal value. Correct. There's no way 37 states would have brought it to the table if it had no medicinal value. Correct. I mean, I just want to go down there, just listen. And anybody who tells you that cannabis, they can't find anything that proves that it has medicinal value, cannot operate Google. And again, I've said this before in one of my speeches, I'll say it again. That is a lie. Quit lying to me. Yes. Because if you can't operate Google, there ain't no reason you need to be sitting in any kind of way of power, because you can look up PubMed and go to town on cannabis and you'll see lots of different things. And, we can just sit down and talk about all my history. And if you can explain medically an alternative that would have been okay, that no other doctor that I saw from Sims Murphy Clinic to you name it, they couldn't figure it out.
It would give you the end result that you have, which is a happy, productive, responsible member of society, because
I pay taxes.
There you go. I mean, it's just incredible the narrative that they push for, all, like I said, any kind of prescription and multiple controlled substances. And then they act like cannabis is bad. What?
Yeah.
What?
You are more in danger from a vending machine. Now, this is a fact. You are more in danger from a vending machine and using one of those than you are cannabis.
Wow. I'm not surprised, though, honestly. I'm probably more at risk wearing this headset right now than to be harmed by cannabis. There are
alcohol. I mean, how many people daily die from alcohol use? How many people daily die from disease of excessive alcohol use? And then how many people die? I mean, and I actually released this. I just can't remember the numbers when we were pushing for 65. I just can't remember it off the top of my head. I'll try to share that sometime. But my point is, go research yourself and see it yourself.
It's there.
Research the alcohol daily stuff.
If my dad can find it, anybody can find it. Just get on Google. It's your friend. You can even, it's all there. It will teach you.
Alexa.
Yes.
Ask Siri to help you figure it out. It will happen. And really, you start thinking about the danger. I mean, there's so many more dangers with alcohol than cannabis ever even dreamed of trying to be. Like, come on, man.
Yes.
Alcohol is dangerous.
It's horrible. It's absolutely horrible.
I hate alcohol. I always have. Luckily, my mom said that she prayed over me when I was young, that every time I drank, I'd get sick. Well, I do. I'm not a firm believer, but something works. I don't drink. I don't drink except twice a year, the day she died and her birthday. Cheers, Mom. But yeah, so I agree. Alcohol it's horrible. It takes so much from so many people, and that's what they've made cannabis out to be this horrible thing, and they've put so many people in jail and taken their lives, their homes, their children. It blows my mind. It could,
and that's what we're gonna fix, because it's just no longer okay. And we're not going to let it happen. Generations before us allowed it to pass. We're the ones that are going to stop it. It's over. It's
2021. We are changing the things we cannot accept. And this is one of those things that we cannot accept any longer. I'm not okay with kids suffering. I'm not okay with grandma suffering. I'm not okay with people our age suffering. When there is a better, safer alternative that truly helps. I think if it didn't help, half of us would have given up by now, honestly, but we know what it's capable of. We've seen it. And so if it takes stepping out and saying, I'll be the one, I'll go, that's what we're doing here. We're standing up. We've had enough, and we're going to change it, whether they like it or not. And it's incredible. And I just want to thank you for being open and honest, because it's never easy to get on in front of somebody and talk about your medical issues, talk about your struggles financially. And one thing I didn't ask you about that I do want to touch real quick is, talk about selling everything that you own to get to access to medicine, because that is something that is so heavy that really I can't comprehend. And you're not the only family I know that has literally sold all their possessions, left their family members behind, because this plant saved their lives. They did it to save their lives.
And I mean, it's difficult to think about, doing that, but it's not just a sacrifice I had to make then. Once I discovered cannabis is not covered under insurance at all. No. So, I mean, I don't go to the salon and get my hair done. I haven't in quite some time. So when I stopped being able to do that, I just grew out my hair for locks of love and chopped it off. So you can do all these different things. I pluck my own eyebrows. I do my own nails. If I do them, I mean, I make sacrifices. I don't get to go shopping a lot. I don't, I'm happy with that though. I worked in recycling when I was out west, right? Mm-hmm. So of course now the trauma of throwing something into a landfill, I just can't deal with that. You think like big city Portland and landfills, and I was there when China wouldn't take our recycling anymore, and it was like so no, I know
what do we do with all our trash?
No, exactly, you do. And then it was like I saw the importance of, that's why I push things like hemp plastics, and I studied home building and things like that, because I see that there is a trash that we have to make into a treasure, which is where earth ships and earth bags come into play. And then you have things like hemp plastics that we need to start making things out of that we normally would make out of plastic, all these different things that we put in plastic packaging could be made with hemp plastics that biodegrade. Yes. Corn resin plastics.
And would save
you can make all the to-go stuff that a fast food place with corn plastics.
And would save us so much money long term. I know my brother lived in California for a time, and we joked about how many trash cans he had, because it literally was like a trash can for every, your cup goes here, no, this goes here. And they're very serious. I live in Olive Branch, Mississippi, and I will tell you now, the recycling truck comes down my street maybe once a month.
Oh no, see, it was my job to make sure that people recycled and composted properly. and I had to report them to the city if they didn't.
Compliance, baby. Yes.
Yeah. So I worked a lot with the city, actually, in educating people in proper recycling. And that's what I'm saying. The more and more you discover that no matter what, a lot of times these things went to the recycling facility and they were still brushed off in the trash.
Mhm.
And people would still try to hide garbage and stuff in it. Okay, well, if we start just requiring manufacturing to be from biodegradable products across the board, you make that a requirement in the next 10 years and every company has to comply.
Yes.
You change the face of the planet, and hemp plastics are where that comes in, and a cheap, sustainable, because you can harvest within months,
Yes.
and it's
And
so healthy for the soil.
Lego has even started using hemp
Yeah.
plastics too. So if Lego
Love
can
Lego.
do it, then anybody, it can be integrated into any business. I firmly believe that. It's just we've got a lot of things to work on, but I think we're making progress.
Oh yeah, for sure.
This is going to happen. Medical cannabis is going to happen. We're going to have flower. Rest assured of that. We're going to have these things. And the beauty of it is, if the program doesn't work, we can tweak it at any time. One of the speakers in the congressional hearings said, this is something that will evolve. You're always going to need to tweak. You're going to need to work with, like, you may set up a limit now that, 2.5 ounces, and then you find out 2.5 ounces doesn't work. We've got to go way up on that. So I think it'll work. I think we're having a lot of important conversations, and education is everything. Just having conversations with people, and understanding that cannabis provides not only a better quality of life, but so many other things it can help with. And
Absolutely.
It can solve problems, and not just for people, like world problems, like
environmental problems. And then, not to mention, I love it when people say that they don't like cannabis, and I say, oh, so you're against phytocannabinoids? And they say, absolutely. And I say, okay, do you like black pepper? Do you like chocolate? And they're like, yeah. And I'm like, well, you can't anymore because those are phytocannabinoids. And they're like, oh. And then this one lady one time was like, CBD products are not FDA approved. And she had a mask on, and then she started talking about her vaccine. And I said, oh, you've had your vaccine? She was like, yeah, both rounds. And but she said, I had earlier in the conversation, she had said that a doctor or something, her family had said that CBD, not to use it because it wasn't FDA approved. And I said, oh, so you had your vaccine? She said, yeah. And I said, oh, also not FDA approved. Thanks. Have a good day.
Do you want to have a conversation? I don't think you do right now.
So it's like, don't come in here like knocking like CBD products for not being FDA approved when they haven't even approved your vaccine. Like, leave me alone. Yes. Cannabis has been proven to be safe. And there's years and years and years of history, thousands of years of history before this 100-year drug war.
That's it.
Yeah, we were in the 1800s and we're in the pharmacopoeia 100 years ago. Cannabis in every cough medicine in every shelf. I mean,
in every medical publication that you can find, it was the drug of choice, as were some other things like heroin and things like that. They were in there too.
They were.
It's kind of funny.
What do they say about the good old days, right?
Yes.
Like, oh my. But no, I'm glad some of the things fell away, obviously, for sure. But one thing they still can't say is that marijuana deserves to be a Schedule I drug. Marijuana in itself, the name is so derogatory. I mean, cannabis will save the planet. I've always felt that way since it saved me. And it saved my world and me for my family. And I'm not saying that what worked for me will work for you. Right. I'm never saying that. I'm just saying cannabis is the safest alternative because you can't play with how many Tylenol you take without risking your life. Yeah. You can't just take 8 Tylenol if you're feeling extra bad. But you can, have a CBD sucker on top of, taking an extra dose of tincture. It's not gonna. You can play with it, and your environmental needs change, especially with conditions like MS, fibromyalgia. When storms roll through, I have crippling migraines when storms roll. I
Absolutely.
can't.
Barometric pressure and
Mhm.
all of those things are wreak havoc on inflammation and
Oh,
your
yeah.
joints and all of that kind of stuff. And
And you can just easily increase cannabis. You have no withdrawal. You can easily decrease the next day. You have no, it's there if you need it for an extra dose. And if you don't, then you don't. And there's no addictive effects. You just feel better and you can go on about your day. It's just not
louder.
this big bad that people think it is. And if you think it's the big bad, I will sit and talk with you. You can come and spend the day.
Yes,
Seeing that it's
exactly.
not. Like,
Yes,
it's just not.
it's not.
Maybe
And
I do need my own show where people just follow me around.
we're going
This
to
is how she
change it. Yeah, absolutely. I mean, Kevin Blackwell is welcome to come to my house and anytime he wishes. I don't think he'll take me up on that invitation though, and that's okay with me. But we are having those conversations that we weren't having before, and that's what's important. Is that we have people that are willing to come to the table, not just in the Senate, but also in the House. We've got people at the federal level that are coming to the table now. So it's not, we're going to get it one way or the other. We're going to get it. And it's just better for them if they would just do it the way we asked and the way that we wrote it and the way that we all voted for.
Let's hope it turns out that way for theirs.
We're gonna get it. We're going to.
We're gonna get it.
I'm not accepting anything less.
I'm not accepting
We've been through
anything
too
less.
much. We fought too hard. We will not back down. We will not stop. This is too life-saving. This is too big.
Yeah. Too important.
It is. And if I die on this hill, then I love y'all. It's been a good hill to die on.
Right.
But anyway, well, we have about hit 1 hour here, so I want to cut you off before I keep you all night. But I just, like I said, thank you for your honesty, because that's what it takes, is people having real world conversations and finding out that, oh my gosh, my next door neighbor uses it.
Yeah.
And
I mean, so
they
many people
have?
look at me and they're like, oh my God, you used cannabis? And it's like, yeah. And guess what? I didn't turn into a frog. Isn't that cool?
I bet there's people even on your street that use cannabis and you don't know. So but it's been nice to have conversations.
Yeah, because all of them love to tell me that they use it in secret. So of course your local CBD store person knows who all uses it in your town. It's so better than being a salon hairstylist.
That's true. That's great. I had not thought about that. But I can definitely, I've been in a vape store too, and I can definitely see how that would be the case. That's great. So, well, thank you, Bethany. It's been good. Thanks everybody for having us on our first session of patient stories.
Great job, honey. I'm so proud of you.
I think we're going to have something every night, guys. So check back and join in with us. And I will be back next week with another patient story. Hopefully I'll have one of my kids' stories to tell next week. So we will see y'all then. But bye, Bethany. Thank you.
Bye, honey. Thank you so much. Bye, love.
And good night, y'all.